Hi, I'm Dr. Lucy Matthews, ear, nose and throat surgeon at the Melbourne ENT Group. In this video, I'm going to talk about a common ENT procedure, nasal cautery. I'll briefly describe the procedure, reasons you might need it, how it's performed and how it feels, the risks and benefits and the alternatives. Nasal cautery is a minor procedure that your GP, ENT surgeon or emergency department doctor may perform during your consultation, using good illumination, with or without magnification, and some form of cautery device, usually a silver nitrate stick. The silver nitrate stick is applied to moist nasal cavity linings, and the end of the stick releases nitric acid, which causes a small controlled chemical burn at the point where it's applied. It's usually performed under local anaesthetic, one nostril at a time, but occasionally it's performed carefully in both nostrils at the same session. Sometimes a fine electric cautery device is used, though this more commonly is used in the operating theatre under general anaesthetic. The procedure usually takes little more than 5 minutes. Nasal cautery is used to either stop an actively bleeding nose or to seal the culprit blood vessel in a nose prone to bleeding. Generally, you are seated in an upright chair, but you may also like to be reclined or lying down. Your ENT surgeon will first apply numbing solution, either as a spray or on a small pack or cotton wool ball, to the nostrils. This helps to minimise any discomfort from the procedure and can also help initially slow down any active bleeding. After the packs have been removed, the nasal cavity is thoroughly inspected to identify prominent blood vessels or bleeding points. The silver nitrate is then applied to these points with light pressure for a few seconds at a time to create a minor, precise burn sealing the blood vessels. If both sides of the nose are treated, your surgeon will be careful to minimise the amount of burning performed and will try to avoid burning directly opposing areas of each nostril. After this is complete, your surgeon may apply a small amount of moisturising or antibiotic ointment or a small dissolvable dressing into the nostril against the treated areas. If there is any initial vigorous bleeding, your surgeon may need to use a small suction device to help clear away the blood. In the rare event that bleeding becomes hard to control with cautery alone, your surgeon may need to place a small pack back into the nose for a period of time. Nasal cautery is generally very well tolerated and is often performed successfully in young children as well as adults. The most common aspect of this part of the procedure is some brief stinging when the silver nitrate stick is applied to the nasal lining, even with good anaesthetic numbing. Discomfort may actually recur 30 minutes to an hour after the procedure as the numbing solution begins to wear off. This mild throbbing or aching settles down over the next few hours, but may need some simple pain relief such as paracetamol. Afterwards, your surgeon will give you simple first aid advice and encourage you to minimise nasal trauma such as nasal blowing and excessive wiping for a week or so. Precisely performed, the risks of nasal cautery are minor. The most common risk is that the silver nitrate cauterized area drips out onto the skin of the upper lip and face and can non-permanently discolour the skin, usually a dark brown colour. If this happens, it disappears after a few days to weeks. The minor discomfort may cause some patients to briefly feel lightheaded or rarely faint, though this is very uncommon. An uncommon but important complication is a septal perforation. There is a small chance that an area of cautery can get infected and or fail to heal, possibly leading to a small hole in the septum, the party wall dividing the nostrils. If this does happen, it often doesn't cause any symptoms but may cause further nosebleeds, a feeling of nasal blockage and crusting. It can be repaired where required. Lastly, nasal cautery may be repeated either on the same side or on the opposite side once the first area of treatment has healed. Generally, the procedure is brief and very effective in arresting minor nosebleeds and preventing recurrence. It's performed under local anaesthetic and so recovery is quick. It can be repeated as required as long as there is adequate healing. There are a number of topical creams and ointments that your surgeon may use prior to considering nasal cautery. These are usually combinations of moisturisers, antiseptics or antibiotics, and sometimes blood vessel constrictors. Sometimes small dissolvable dressings are used where cautery is less likely to be successful or tolerated, for example in patients on blood thinning agents or where the bleeding is from a more diffuse raw area of the nasal lining. Some patients would prefer to have the procedure under a general anaesthetic, and in these cases, electrocautery is more likely to be used. Thanks for watching. For more videos on ENT conditions, treatments and procedures, check out the rest of the videos on this channel or head over to the website for more details and downloadable information sheets.